We've got for carbs and we've got against carbs. What's the optimal carb intake for a diabetic? Hello everybody, Jason Davis here at Body Remastered Coaching. Last time we spoke about carbs and the benefits of having a low carb diet if you suffer from diabetes or you're at risk of diabetes. And lowering your carb intake can have a massive benefit in controlling your fat and reducing your weight, and also getting better management of your glucose as a diabetic. But here's the caveat: carbs are also essential when it comes to someone who trains 4 to 6 times a week, or a diabetic who needs to control a hypoglycemic attack. So it's really important that to not consider carbs as, I'm just going to restrict all my carb intake or lower it to such a level, because a few questions need to be asked. One, can you sustain this? Because remember, at Body Remastered, we fundamentally believe that the best plan is one that lasts for the long term, one that fits in with your lifestyle, one that you're going to enjoy and you're going to stick to. And of course, how do you manage carb intake when you are someone who trains? You're not someone who's sedentary. You're someone who trains. You're someone who has diabetes, but you train 3 to 4 or maybe 5 times a week. So how do we manage carbs from that perspective? First, let's just talk about the major benefits of having carbohydrates. First of all, it's the preferred body's fuel. You get instant fuel, and that's what the body prefers in terms of getting energy, instant energy. Secondly, it can really replenish any depleted glycogen from the muscle and from the liver. And that's important when you're training. I'll touch on that. Next thing is that it's really important when you need to treat a hypoglycemic attack or general hypoglycemia as a diabetic. And lastly, it can really boost your metabolism when your body's gone for long periods of calorie restrictions. And remember, your metabolic rate is key in your overall ability to manage your fat loss. So on the flip side, what does this mean? Well, if your carb intake is too low, you will have the inability to treat a hypoglycemic attack, which is particularly important for those who are type 1 diabetics. You will have potentially trouble in building muscle because of the necessity of having carbs to fuel that training session. You may have issues with training. One, you'll be less motivated to train, and two, your performance. You will notice your performance just isn't as good. You may be trying weightlifting or certain HIIT workouts. You won't be able to go as long. You won't be able to do as many reps because your performance is there, not there because of the depleted muscle glycogen, and it can limit body composition improvements. And it's really important to think that if your carb intake is too low, it can have a massive impact on your overall energy and the way you feel and your mood. And of course, the chances are, as I said, if anything's too extreme, so if you reduce your calories from carbs quite significantly, quite quickly, and not in a gradual way, then yes, you're probably likely to lose weight within the first week or two for sure. But the problem with that is that most of that is going to be fluid loss, and it can't necessarily be maintained from week to week following. So that's why it's important not to restrict it fully. Doesn't always work. It can work in the short term. We're going to think about how does it work in the long term for a diabetic, and also how can we still manage to have good training sessions and keep ourselves healthy. On the flip side, if you have too many carbs, you're going to get into a whole host of problems. First one is increased potential for hyperglycemia, which we know, if your blood glucose levels are too high, we know that has major health impacts as a diabetic. You really want to avoid that. It will increase your chances of building fat and getting fat gain, unwanted fat gain, and also reduce your insulin sensitivity, which is also in hindsight, it's also going to reduce your chances of building muscle. It's also going to increase your appetite. And basically, you're more likely to snack and overconsume on calories just because you don't feel full enough for long enough. So, it might sound confusing. We've got for carbs and we've got against carbs. What's the optimal carb intake for a diabetic? So what does the optimal look like? Well, there's a few things I want you to try to make sure when you're building a plan and you're thinking about your weekly intake of calories, these are the kind of things you need to be thinking about when it comes to carb management. And when you're taking your carbs, how many carbs, etc., the type of carbs. So this is the optimal intake. The first one is make sure you have enough carbs to fuel your physical activities, your training, and to replenish the energy that you need post-exercise. Okay, so think about carb intake post-exercise or during exercise. The second one is make sure you have enough carbohydrates to manage your glucose intake and glucose blood levels, particularly when you're treating hypo. Make sure you have enough carbs available throughout the day and throughout the week to treat a hypo, but without increasing your carb level to too high, i.e. having too many carbs to treat a hypo, or having too many carbs throughout the day when you don't need to treat a hypo, and then you treat a hypo, and overall it means your carb intake and calorie intake from carbs is too much. Next part is you need to make sure you're getting enough fibre from your carb intake. So when you're choosing certain carbs, always think about, has this got some good fibre in it? Because that's key, and that's more essential for good gut bacteria mechanisms within the body. And then finally, make sure that you're having enough carbs to control your mood. And this is very individual from person to person. Some people can get through a day, for a week, with minimal carbs, but they end up just feeling just empty, having no, they get mood swings, their energy really depletes, and that's why sometimes you can see results for the short term, but not for the long term. This is why we at Body with Masters, again, we believe the best plan is one that you can stick to. We don't want you just be able to stick to something for a week or two. It's got to stick for your life, and something that works, and also gives you the knowledge to optimize certain things and change certain things when you need to. And that's why we want to make sure we give you the knowledge on what carbohydrates can and cannot do. Let's just talk about a couple of things. One is how many carbs do you actually need based on the type of activity levels that you're looking at. And then let's just demyth some of the carb myths, particularly out there, and just be clear on some of the facts when it comes to diabetes. So one of the myths I want to really make sure we cover in this video is that this concept that if your carb intake is very high, then your insulin levels are going to go chronically high, and then that's going to mean you're going to get loads of fat. Just not true. Your body can store fat even if your insulin levels are low. It just doesn't work like that. Fat gain is really contributed by the total energy intake from all the macronutrients, protein, fat and carbs. So you need to think of it as energy intake, not just, I keep eating carbs and that's the reason why I'm getting fat. It doesn't work just like that. So let's just wrap this video up with just giving you a few insights in terms of how can I manage my carb intake depending on who I am. So the first one is, as I said, carbohydrates are not classed as an essential nutrient. Your body can synthesize the needs of carbs themselves. However, that doesn't mean you shouldn't have carbs. As I said before at the beginning of the video, they have major benefits. Now let's talk about body composition. If you're diabetic who has quite a lot of muscle mass already, or you want to build a lot of muscle, then it's important not to have your carb intake too low. Your carbs are going to be really, really important in your body composition and making sure that the muscles, you're fueling the muscles ultimately with glycogen, and that's what's going to be needed in order to sustain muscle growth and the performance when you're doing weight training. The other thing is training volume. If you're doing HIIT sessions and you're intensifying them and you're getting better and better, you're going to need carbs. You're going to need to slightly increase your carbs in order to make sure you've got the energy post those workouts and also maybe even during them as well, so you can replace that energy. It's really important. So the first question will be, what's your ultimate goal? Is it fat loss or is it muscle gain? Now it might be both, but you need to understand what's more important first. Okay, so if ultimately I really want to build mass, then carb is going to be really important. You might want to increase it a little bit and not have too low a carb intake, because you're just not going to be able to improve your muscle mass composition. Whereas if your ultimate goal first is fat loss, then you really are better off increasing your protein and fat intakes. One, to make sure you're controlling your appetite, and also just so you're controlling the amount of overall carbs and calories that you're eating throughout a day or throughout a week. Next important factor for a diabetic is your glycemic control. Where is your current blood glucose level averaging at the moment? If you're at a lower blood glucose level and you have more chances of having a hypoglycemic attack, you can manage your carb intake based on that information, and that can be very quickly corrected by having some carbs to rectify the low blood glucose levels. If you're a person that has quite high blood glucose levels, and that's what you're trying to really bring down, then you could really benefit from having an overall lower carb intake in your diet until that's corrected. So in terms of time to eat your carbs, I wouldn't get too bogged down with this, because we all live busy lives and we have different situations, and ultimately it's not going to make a huge difference. But really your carb intake should centre around, especially if you're trying to reduce your carbs restabilise your blood glucose levels, is really have your carbs during training sessions, after training sessions, around physical activity, and of course to treat hypoglycemic attacks or any bouts of hypoglycemia. You also got to think about training days and non-training days. The demand for carbohydrates are going to be higher during training days than they are during non-training days. So you can optimise and manage your carb intake based on that as well. Because remember, it's not just about day to day; it's about week to week or even month to month. Look at your carb intake over the week. Some days you may not have well managed it, but over the course of the week it may be well managed. Okay, that's all folks in terms of what we're covering in terms of carbs, in terms of its benefits, and making sure you're making it optimal depending on if you're training or if you're sedentary, and managing your blood glucose levels. In the next video we'll talk about how you can actually set up and make your own diet, how we can start counting carbs and the processes that are involved in that. It's really important for someone suffering from diabetes or at risk of diabetes. It's going to make all the difference. So check out the next video when it comes. We'll start talking about, it's probably going to be multi-part again, because we'll start talking about how we build, considering fat and protein as well, how do we build the right diet that's for you based on your body composition and your blood glucose levels. Great, thank you very much for listening. Once again, we're not doctors, we're not medical professionals. All of this is for advice and educational purposes, so make sure if you do make any drastic changes in your diet or your carb intake, that you consult your medical professional first. Other than that, make sure you can subscribe and like the channel. We'll keep giving you this information. Really looking forward to the next video where we'll help you build your own diet, and we'll go from there in really improving your fat loss journey and potentially even building some muscle. Speak to you again soon. Bye.